And we've now got Kerry Short, and Kerry Short is this wonderful, bright, spark person. And Kerry, how lovely to see you.
Thank you.
Please sit yourself down. And you are, as we've just heard, the recipient of the Pat Fry. I don't know whether you heard the wonderful things about you.
No,
but,
I didn't.
Well, there you are. It was all bad. So, Kerry, you've been a recipient of this grant, and I'd love to hear all about you. And my understanding of it is you did the RMIP program last year.
I did.
You're a trainee intern this year, and you've been in 3 different countries, I understand. So would you like to tell us about them?
Well, it's been a bit of a whirlwind, really.
Yeah.
So I started off in Nepal for 5 weeks,
Yes.
based just outside of Kathmandu in a rural centre at a mission hospital. And then I moved through to Zambia and into a rural hospital there, sort of near the border of Malawi. And then did the Flying Doctors for a few days up in Tanzania.
Is that right?
Yeah, so it's been all over.
And you couldn't have done that without the Pat Furry Trust grant.
Absolutely not.
So that is outstanding. Well done. So what made you pick those countries? I presume you could have gone anywhere in the world you wanted, including Invercargill.
Yeah. So it truly is a blank canvas. You sort of almost want to throw a dart at the map and just pick anywhere. But well, Nepal was something special for me. My parents met there sort of 35 years ago now. Yeah. So I think I always wanted to go there. And the reason I chose sort of third world countries was I was really looking for somewhere resource limited and somewhere that would challenge me, and we wouldn't have access to the things that we have here, and sort of learn to do medicine in a slightly different way. So that's really why I chose to go where I went. And everybody dreams of going to Africa.
You're right.
It's just one of those things.
Yeah, absolutely right. So we've got some slides coming up in a short while, and once they appear, you may be able to talk us through them. In fact, here we are now. So would you like us to talk us through these slides and tell us what's happening? There's a very good-looking person there, I can see.
So my fabulous white coat that we no longer wear in New Zealand, but they do over there. So this is in Nepal. This is Share Memorial Hospital, which is the wee mission hospital. So that was in Banapart, and that was a hospital of about 300 beds, I think. So we had quite a few different wards and facilities.
I suspect it wouldn't have been as similarly staffed as we would staff a 300-bedded hospital in our country. So,
absolutely not.
Well, how staffed was it?
Well, very limited. So there was mainly foreign doctors sort of working alongside Nepali doctors there, and they're constantly relying on volunteers coming over.
Right.
However, they do have a nursing school, so they're doing quite well in that respect. Yeah.
So perhaps there's another slide. If we see the next slide, there we are. So would you like to talk us through this one there?
So I'm here with a couple of the nurses from the special care baby unit, so you can see our wee premature baby in the background of us there. So I was doing obstetrics and gynecology for a couple of weeks, and really forced to look after premature babies, which I hadn't done before. So.
Now, I've heard that the responsibility of elective students can be well up and above what you would get if you're a 5th-year student in your So what responsibilities were you given?
Absolutely. So sometimes I'd be at the delivery by myself, having babies coming out with breathing difficulties, having to do resus myself.
Wow. Whereas in this country we'd have a senior registrar or a consultant doing that
Absolutely.
job.
I'd be standing watching in the back corner.
So what training did you get for that?
None.
Excellent.
So that's really where things like the RMIP program sort of came to the forefront. I'd had opportunities in teaching, learning one-on-one, and I was trained to do this kind of thing.
This is wonderful and completely uncued. You see, we're promoting the Pat Fry Trust and the RMIP all in one hit. We're getting value for money out of it. Let's try the next slide if we can. And so there we are.
So that's the beautiful Himalayas in Nepal, so I waited hours for that shot to come in. So there was a couple of days there where that was all fogged out, so this was our last morning and our last chance, and it came around.
Yes.
So.
And how high off the ground are you? Well,
I have no idea.
5 feet, but you don't need oxygen where you are then, obviously.
No, we don't. Yeah, it's a beautiful view.
It most certainly is. And then we've got another slide. I don't know how many we've got here.
So this is St Francis Hospital, so this is the one in Zambia.
So we've moved from Nepal to Zambia now.
We have, yeah.
So what were you doing there? So we're Skibu in Nepal and now in Zambia. So what were your responsibilities there?
I went onto a paediatric ward where we could have over 70 children on the ward at any one stage, in which there was 2 doctors, myself and 2 nurses for 70 children. So often I was left running the ward myself, which is a whole new experience. So I'd have whatever emergency kind of turned up, I was there to deal with it.
So they had no training. You must have had some wisdom and knowledge from somewhere. Did you speed read a paediatric textbook? Or?
You try to. Yeah, it's whatever you can grab, really. Obviously the people that I was working with were very highly trained and sort of gave me quick tutorials on the way through, but basically just relying on what I've been taught.
Look, it's a very fair point, and you brought in an interesting concept, and we were talking about this earlier on, how important nurses are to rural health in this country as well as that, and it's very commensurate with what you've just said, so thank you for that. How are we doing for slides? So here we are.
So this is me out on a rural clinic with the flying doctors up in Tanzania.
Yes.
So this is our examination table you can see on the little child sitting on, which is just a bed of sticks really. So we're out in villages that can be up to 150 k's away from the nearest healthcare, and the only access they get is us flying in there. So that was beautiful really.
Well done, that's lovely. I think we've got one more slide to go, the last slide.
Oh, you can't go to Africa without doing this.
No, absolutely right. So I presume you were seconds away from being eaten there, I presume.
Oh, absolutely. I was scared for my life.
Yes, yes, yes.
No, so these are hand-reared lions. They'll take the cubs and put them back in the wild.
Oh, right.
So they've been rescued, really.
Right, so it's a very large pet cat.
Yes.
Yeah, yeah.
Absolutely.
But a very large pet cat. Were you a little bit scared? I think most mortals like me would be.
No, the guy taking the photograph was like, I've never seen somebody smile so much at this moment. No, you've got to live life to the full.
You most certainly do. So, although, look, you obviously had a wonderful time and a brilliant, sounds like a holiday almost, really, in one regard. But you also obviously reprogrammed your brain to, in a slightly different way. So, the Kerry which came back compared to the Kerry which went out, how would you compare and contrast the two Kerrys?
Oh, completely different, really. Just so much more confident in my own abilities to recognise and formulate diagnoses and sort of evaluate a patient without the need to run quickly off to find an X-ray or a CT scan. I mean, the ability to do that is just amazing. And certainly walking back into a main hospital now, I certainly trust my instincts and my gut feeling.
That's nicely put. I would like to think that Pat would love to think that his trust is going to forge future rural GPs and make recipients of the grant ambassadors for rural cause. So have you wired your brain onto, you would have been rurally wired anyway doing the RMIP, so you're being indoctrinated everywhere. But has it changed your rural focus at all?
I think it makes me understand that rural medicine is very exciting. There's so many opportunities, it's not what people think it is really. And I can't help but think that's exactly where I want to head.
That's absolutely outstanding, well done. So if you had your time again, would you have gone to those 3 countries or would you have picked different ones?
It's always hard to know, but no, I definitely loved where I went, and I mean, I'm sure to go back there one day, I think.
Excellent. So if I was now a third-year medical student and thinking about my elective, what would you say to me?
Choose somewhere that challenges you. Don't go for the easy. You know, you can do the medicine we do here in New Zealand in a number of different countries, and I think that's the cheat's way out. I think if you really want to learn something, you have to challenge yourself and throw yourself off the deep end. That's
very nicely put. So there I am, third year medical. That sounds wonderful. How would I go about finding what is going to challenge me? Because it's a big world out there. So how would I do my homework to find out where to go?
Well, I suppose it's talking to people like myself. There's over 200 people going on electives every single year. We all have different opportunities. There's elective reports that they can read. There's the electives network through the MAS website that you can access, and that just gives you all the information that you need. But overall, it's about what excites you the most. Where do you think you're going to find that? And just start Googling, use the internet. It's perfect.
Excellent. Well, that's actually first-class advice. Well, thank you very much indeed.